The Federal Ministry of Health, through its Public Health Department, recently organized an engagement session with media executives and producers. Workshop held in Malaria, Nasarawa State stressed the importance of utilizing proper communication channels to disseminate precise information about malaria. Let's join our correspondent Elizabeth Kasham.
The coordinator of the National Malaria Elimination Program, Dr. Godwin Etado, emphasized the necessity of employing the right medium to educate the public about the disease. Represented by the head of Federal Ministry of Health Advocacy, Communication and Social Mobilization, Mr. Raphael Onilo, Dr. Godwin stressed the crucial role that the media plays in educating citizens on prevention and treatment of malaria.
To make them to know more of the information on malaria, that is to say, to increase their knowledge. Yes, they have the knowledge, but we want their knowledge to be increased more so that they can give adequate and correct information to our people regarding malaria.
He said the Federal Ministry of Health remains committed to leveraging strategic partners and communication channels to create a malaria-free future for Nigeria. In an interview with ASU television crew, representative of Breakthrough Action, Dr. Olushola Adewoye, spoke on health intervention areas, emphasizing that positive behaviors related to malaria could significantly contribute to a reduction in malaria cases.
Behaviors. There are certain behaviors that are associated with malaria in its prevention. For example, the use of insecticide-treated nets regularly by communities, the uptake of preventive treatment by pregnant women so that they don't get malaria in pregnancy, the correct application of tests to fever to confirm that that person has malaria by healthcare providers. And then once they've confirmed that the person has malaria, they now go ahead and treat with only ACTs, artemisinin-based combination therapy. Then make sure that when they start using the ACTs, they finish using it. They don't stop halfway because they are tired. They must complete the usage of those drugs and many others. These are just examples, and that is what we are pushing for in engaging the media.
Participants at the workshop echoed that the media serves as a powerful tool in shaping public perceptions and behaviors towards malaria, as they stress the need to reinform Nigeria's populace to eradicate misconceptions surrounding the disease.
A lot of assumptions and exaggerations when it comes to malaria. So now today, this workshop generally has taught us that there are a lot of things that you think you know. There are a lot of things that you see and you assume that is what it is, but it's not the right thing to do. So there are certain steps that need to be taken. So basically, it's just about taking this information back home, going to make sure I re-inform my own audience, re-inform the general public, and let them know the right steps to take in treating malaria.
Afforded me the opportunity to know in detail what causes malaria, how it can be prevented, how it can be treated. It also opened my eyes to see a few other things that is not so common, like the MRDTs. It's not something that you just know about just like that. I got to know it and know that it is authentic, because we Nigerians sometimes when we see something so easy we think that it must be fake, that's why it's so easy. But I mean, it's legit. If it says you're positive, and if it says you're negative, you're negative.
The World Health Organization reported malaria as a major public health concern in Nigeria, with an estimated 68 million cases and 194 deaths due to the disease in 2021. According to its report, Nigeria currently has the highest burden of malaria globally, accounting for nearly 27% of the global malaria burden. Elizabeth Kasham, ASU Television News.